Hi, it's the nursing professor, and it's Professor Jones. And I wanted to talk about Erikson's stages of development. This is basically a psychosocial theory that basically explains how one's personality is formed. It's saying that there is a conflict slash challenge that's present in every different level of life. And depending on how you deal with the conflict slash challenge, either you develop a strength or you develop like a maladaptive tendency. It's very useful in figuring out people. So I find it useful when for nursing, clearly, because if you can understand the person's challenge, then you can have a little more empathy for them and you can understand better how they're feeling and maybe why they respond the way they do and some of the things that you could do to help. So from birth to about a year, the challenge slash conflict is trust versus mistrust. So as the infant is held, fed, nurtured, and loved, they develop trust. So if you come out of this stage in a positive manner, you're trusting. From ages 12 months to 3 years, you are dealing with autonomy versus shame. So this is the stage where you see the little children who start saying, no, and they want to do it themselves. They are developing autonomy. Can they do it for themselves? Can they handle the things that they need to do by themselves? If you come out of this well, they get a sense of independence and they feel good about themselves. If they're not really successful with this stage, they're unable to act on their choices. They have a lot of doubt and they don't feel confident in themselves. So understanding that makes you look at toddlers slightly differently. The next stage would be 3 to 6 years old, and you're dealing with initiative versus guilt. And at that stage, kids are usually able to initiate interactions with other children. You see this on a playground, in different social circles, like at school, they will want to play with a certain toy. And so if they're able to have some control over what they can and cannot do, like through different social interactions, they develop self-confidence and purpose because they're able to initiate. If they're not successful with this, they have feelings of guilt. The next stage would be 7 to 11 years old, and that's industry versus inferiority. So basically, this is when kids begin to compare themselves against other children. They want to see how they stack up. So this is the stage where they start playing sports and they're in dance or competitive cheerleading, swimming, all the things that children like to do. And they're basically saying, like, how do I stack up? So if they're successful in this stage of life, they develop a great sense of pride and they have a sense of accomplishment with their friends and with the different activities that they might be involved in. The next stage is 12 to 18 years old, and this is identity versus identity confusion. Now, when you understand this, because this is that tricky age where most parents are fussing about the teenagers, they're so, obstinate and, don't want to be bothered. Well, they're trying to figure out who they are. So at this stage, they try on various different personalities. They they push the boundaries because they are trying to figure out who they are. What is their moral code and what do they stand for? So when they come out of this stage successful, they have a strong sense of identity and they have values and beliefs that they really stand true to. Unsuccessful, they have a weak sense of self, role confusion, and they're unsure of their identity. The next stage is your 20s through your 40s, and this is intimacy versus isolation. In this stage, we just finished the other stage where they're feeling a strong sense of identity and they know their moral code. So in this stage, 20s to 40s, they're ready to share their life with others and develop the deep, intimate relationships with families and significant others. So if you're successful in this stage of life, you enjoy intimate relationships with others. Now, again, this can be your family, this can be friends, it can be a significant other. It doesn't have to just be a soulmate. If they're unsuccessful here, they usually experience feelings of loneliness and emotional isolation. The next stage is generativity versus stagnation. And this is the 40s to the mid 60s. This is my stage. And this is known as middle adulthood. And if you're successful here, you're finding your life's work. You are working and contributing to the development of others and giving back to the community. And a lot of times this is a busy time of your life because you're raising your children or your children are nearing college and all of that. So you have a lot of things in your life that's usually giving you some sense of pride and feeling like you're giving back. If you're not successful, then you're in stagnation. and you usually have little connection to others, little interest in productivity, and self-improvement. The next stage is mid-60s to the end of life. So this is the last stage. The conflict challenge here is integrity versus despair. So if you're successful in late adulthood, you normally have a sense of satisfaction with your life. You're able to look back over your life and feel pride and a sense of satisfaction, and you have few regrets. If you are not successful, you have a sense of failure. You tend to focus on the would have or the should haves, or you face your end of life with bitterness and despair. So understanding that sometimes when you're dealing with patients in the role of a nurse, or even in other aspects of life, you can kind of understand, okay, this person might be dealing with this. So sometimes when you have a better or a broader understanding, you can approach a situation from a different viewpoint.